Welcome to today's Explainer. I am so glad you're here with me today. If you're tuning in, well, there's a really good chance you're dealing with a silent, heavy struggle, one that millions of us face, yet somehow so few truly understand. I'm talking about chronic morning heel pain. It's the kind of condition that can slowly, quietly shrink your world. But today, we're going to unpack exactly why it happens, and much more importantly, how we can help you reclaim your mornings. Let's dive right in.
I want you to think back to this morning. You wake up, right? You stretch, you swing your legs over the edge of the bed, and then comes that very first step. Did you feel a sudden, sharp, stabbing pain shoot right through your heel? That awful electric shock that makes you freeze for a second, maybe even forcing you to reach out and grab the wall or your nightstand just to keep from falling over? It's a deeply agonizing, completely invisible pain that so many of us are just silently enduring day after day. You know, the way people describe this pain is truly visceral. A lot of folks say it feels exactly like stepping on shattered glass, or literally like a heavy nail is being driven right up into the bottom of their foot. It is brutal, and I really want to validate that for you right now. This is serious. This is not you being weak, and this is absolutely for sure not just a normal part of getting older. It's a specific, mechanical, physical condition, and it's one we can actually do something about.
Section 1. Inside the nightly cycle, the hidden mechanics of morning pain.
To really get why this pain happens, we have to look at the plantar fascia. This is a thick, incredibly strong band of tissue that runs right along the bottom of your foot. It connects your heel bone straight to your toes. You can think of it as your body's built-in, heavy-duty shock absorber. Every single day, as you walk, stand, and go about your life, this incredible piece of tissue absorbs thousands of pounds of pressure. But over time, especially after we cross that 50 mark, this tissue can become overstressed, worn, and deeply inflamed. So here is what we call the sleep cycle trap. During the night, while you are sleeping comfortably, your foot naturally drops into a relaxed, pointed position, kind of like a sleeping ballerina. Because of this, the plantar fascia tightens up. Now, while you sleep, the tiny microscopic tears in that tissue actually begin trying to heal themselves. They start knitting back together. But then morning comes. You wake up, you suddenly stand, and bam, that rapid stretch violently rips those delicate, partially healed fibers wide open all over again. And that right there is exactly why those first few morning steps feel so utterly brutal. Now, here's a little phenomenon that confuses so many of us. You've probably noticed that after hobbling around the house for 5 or 10 minutes, that sharp pain actually starts to fade away. And a lot of people think, oh good, it went away, it's getting better. But I have to warn you, the pain is temporarily decreasing simply because the tissue is warming up and stretching out. It is absolutely not because the damage is gone. Actually, the microscopic tearing and the inflammation, they are still quietly happening right underneath your heel. Section 2. The full body domino effect, how foot pain alters your body. Here is where things get really tricky. When your heel hurts, your brain automatically steps in and forces you to change the way you walk, just to protect that tender spot. You might start walking on the outside edge of your foot, or maybe you develop this slight limp without even consciously realizing it. Well, this altered gait seems harmless enough at first, but months later, it slowly and systematically damages your other joints. Suddenly, out of nowhere, you're dealing with aching knees, incredibly stiff hips, and a strained lower back. What started as one localized foot problem has now cascaded into a full body domino effect. And honestly, we cannot ignore the psychological toll here. Our expectation is usually that foot pain is just, a physical nuisance. But the reality, chronic pain fundamentally alters your behavior. You start losing trust in your own body. You become afraid to take long walks. You start skipping grocery trips. You decline those fun family outings. This underlying fear of pain leads to inactivity, which often leads to weight gain, a drop in your mental well-being, and a really devastating loss of your daily independence. It just makes your whole world feel so much smaller.
Section 3. Common mistakes and myths. What makes inflammation worse?
Let's go ahead and address a really common fear, the dreaded heel spur.
So many of us go in, get an x-ray, see this bony little growth called a heel spur, and absolutely panic, thinking, oh no, surgery is my only option. But here's a very comforting medical fact for you. Heel spurs are often completely painless. They are rarely the primary cause of your agony. The real culprit is almost always that tight, inflamed plantar fascia surrounding the area. So please, do not let a scary-sounding x-ray report terrify you into thinking your situation is hopeless. Okay, let's look at some of the hidden, everyday mistakes that are silently making this cycle so much worse. Number 1 is walking barefoot on hard floors, like your kitchen tile or hardwood. After age 50, the natural fat pad under our heel thins out. It loses its natural padding. So walking barefoot literally strips your heel of its last line of defense. Other sneaky mistakes include wearing those flat, worn-out shoes around the house, aggressively overstretching the foot when it's already fiery and inflamed, and ignoring things like dehydration or systemic inflammation, which drastically slows down your body's natural ability to heal those microscopic tears.
Section 4. Actionable daily relief habits. Taking back control before you stand. Now for the good part. This is one of the single most effective, gentle routines you can adopt. We call it the morning towel routine. Before you even think about swinging your legs out of bed tomorrow, I want you to keep a rolled up hand towel right there on your nightstand. While you're still lying down, just loop that towel gently around the ball of your foot. Keep your legs straight and very gently pull the towel upward towards your body for about 20 to 30 seconds. What you're doing here is slowly, lovingly waking up and stretching that tight plantar fascia instead of shocking and tearing it the second you put your weight on it. Next up is a quick step-by-step guide for your indoor footwear because remember, that thinning fat pad really needs our help. Step 1. Please, I am begging you, go to your closet and toss out those old, flat, worn-out slippers. I know they're cozy, but they are doing you absolutely no favors. Step 2. Choose indoor footwear that has firm supportive arches built right into them. And step 3. Put them on immediately upon waking. Seriously, never take a bare step on a hard floor again. Let the shoe absorb all that shock, not your poor inflamed heel. Managing your daily inflammation levels is absolutely crucial. You'll want to apply ice therapy to your heel for about 15 minutes after any heavy activity to really calm those fiery tissues down. Again, never walk barefoot indoors. Also, managing your body weight gently can dramatically reduce the daily pressure you're putting on your feet. And, most importantly, you have to maintain consistency. Setting realistic expectations is so vital here. This condition took a long time to develop, and the healing process, well, it's going to require some patience. It often takes weeks or even months of consistent care to really turn the corner. Now, if you find that you've been doing these conservative methods for a few months and they just aren't quite enough, rest assured there are some excellent professional treatment options available to you. Your doctor might recommend dedicated physical therapy or maybe custom-molded orthotics for your shoes. They might also suggest night splints, which are these incredible devices that gently hold your foot in a stretched position while you sleep, which prevents that morning tightness entirely. In more stubborn cases, they might even suggest anti-inflammatory injections or shockwave therapy. The point is, you have options. Section 5. Regaining your physical freedom. The emotional relief of healing. I really need you to hear me when I say this. You are not weak. You are not lazy, and you are not just getting old. Chronic pain changes us, doesn't it? It affects our mood, it wrecks our sleep, it even strains our relationships. It is entirely valid that you feel frustrated by all of this, but please give yourself permission today to let go of that silly stigma of aging and give yourself permission to actively seek the help and make the changes that you so rightfully deserve. As our source material beautifully points out, understanding why the pain happens is the first step toward taking control back. When you start implementing those simple morning towel stretches, when you commit to wearing the right supportive footwear, you aren't just healing a ligament in your foot. You're actually regaining your mental confidence, you are reclaiming your daily independence, your morning walks, your family outings, and ultimately, your joy. So, I want to leave you with a thought to reflect on today. How long have you been silently dealing with morning heel pain? Because you don't have to suffer in silence anymore. Tomorrow morning, before you even think about jumping out of bed, just pause, stretch that foot, put on those supportive shoes, Listen to what your body is asking for. Thank you so much for joining me for this explainer. Please take good care of yourselves and go take back your mornings.